Some of the common injuries that we see with patients coming out of nursing homes repeat themselves. It tends to be cyclic. First and foremost, we see a lot of bed sores. Now, sometimes bed sores can be caused just by the patient's condition and the disease process, but a lot of the bed sores are preventable. Typically, whenever you see a bed sore developing, the first thing you want to think about is the care that the patient is receiving on a regular, consistent basis, because failing to turn and reposition patients at least every 2 hours will result in the development of these bed sores. And unfortunately, these patients are already debilitated, and these bed sores can lend themselves out to not only pain and suffering, but a lot of times infections will set in, and they're very, very difficult to heal. The second thing that we tend to see a lot of is dehydration in this population. When patients get to this point where they're in nursing homes and they need 24-hour round-the-clock care, most of them need some level of assistance when setting up their trays in order to eat and to drink. And a lot of times we find facilities will set the patient up, but they won't assist them with eating and drinking. And as a consequence of that, the elderly can dehydrate in a very rapid period of time. And as a result, it's very difficult for these patients to recover, and it can have catastrophic effects. And lastly, one of the most common injuries that we see is obviously falls. Patients that are attempting to get out of bed by themselves because call lights aren't being answered in a timely manner. Patients that are left in jerry chairs for a long period of time, they're attempting to get out, or patients that have behavior dementia type issues. Those patients need to be watched closely, and as a result we see a lot of falls. And with falls, typically they can have very catastrophic results for the elderly. Broken hips can lead to infections, which also, if the patient has dementia, we see after a fall, we see that dementia actually worsen, which can ultimately lead to the patient's death.